When is an FNA biopsy needed for a thyroid cyst? Imagine feeling a lump in your neck and wondering if it's something serious. When it comes to thyroid cysts, knowing when to get a biopsy can help ease your mind and guide your treatment. A fine needle aspiration biopsy is a simple, minimally invasive procedure used to check if a thyroid cyst or nodule is benign or potentially cancerous. It's usually recommended when the cyst is larger than about 1 to 1.5 centimeters in diameter. If the cyst is smaller, especially under 5 millimeters, a biopsy is often not necessary unless there are other risk factors involved. Ultrasound imaging plays a big role in deciding whether a biopsy is needed. If the ultrasound shows suspicious features like irregular edges, tiny calcium deposits called microcalcifications, darker appearance on ultrasound, increased blood flow, or a shape that is taller than wide, doctors may suggest an FNA. These features can sometimes indicate a higher risk of cancer. Even if the cyst has a solid part or a mixed cystic and solid structure, a biopsy might be recommended to get a clearer picture. Other factors can influence the decision. If the cyst is growing rapidly, causes symptoms like trouble swallowing or hoarseness, or if there's a history of radiation exposure to the neck area, your doctor might suggest an FNA regardless of size or ultrasound features. Sometimes, if a previous biopsy only collected fluid or didn't provide enough cells for diagnosis, a repeat biopsy guided by ultrasound can be helpful. The procedure itself is safe and usually done in a doctor's office using ultrasound to guide the needle. This ensures accurate sampling, especially if the cyst isn't easily felt or has a lot of fluid. The main goal is to rule out cancer because most thyroid cysts are benign, but a small percentage can be malignant. Knowing whether a cyst is benign or suspicious helps determine whether you can watch and wait, need further testing, or requiring surgery. In summary, an FNA biopsy is generally advised when a thyroid cyst exceeds 1 to 1.5 centimeters, shows suspicious ultrasound features, grows quickly, causes symptoms, or if previous biopsies were inconclusive. Always remember to discuss your specific case with a healthcare professional, as individual factors can influence the best approach. Getting the right diagnosis is key to managing thyroid health effectively and safely.